Hello, and welcome to today's video on the Inflation Reduction Act. Today, we will be covering a few items on our agenda. We are going to take a look at what the Inflation Reduction Act is. What does Part D or prescription drug coverage look like today, and what will it look like in 2025? What do the changes mean to you? We're also going to take a look at the Medicare prescription payment plan that's also known as M3P, and we'll take a look at some programs called Extra Help that can help you reduce the cost of your prescription drug coverage. My name is Margarita Cordova. I'm a licensed insurance agent based out of San Antonio, Texas, and I love helping people understand their insurance options. For me, it's the best feeling when my clients walk away with peace of mind, knowing that they made the right selection for themselves and their needs. What is the Inflation Reduction Act? Well, it was passed in 2022, and it phases in improvements into Medicare that'll help expand benefits. It'll help lower drug costs. It'll also help stabilize drug plan premiums, and it'll improve the strength of the Medicare program now and in the long term. Before we get started on the rest of our presentation, I'd like for us to take a look at some definitions that will serve us later on. The first keyword that I wanted you to look at is the word premium. A premium is the monthly cost associated with the insurance plan that you've selected. So it's what you'll be paying every month for that plan. A deductible is the amount of money that you must pay before the insurance begins to cover your claim. A copayment is the set dollar amount that you will pay when you see a doctor or when you pick up your prescription. Lastly, the out-of-pocket max. The out-of-pocket max is the most you will pay for covered services or prescriptions in one calendar year. Think of it as your safety net. So if something really catastrophic happens and your co-payments for your covered services reach whatever the out-of-pocket max is for your plan, then you no longer pay any co-payments for the remainder of the calendar year for your covered services until January when you start all over again. The Inflation Reduction Act, like I said earlier, it's a phased-in approach. In 2023, we saw that covered insulin was capped at $35 a month. We also saw that recommended adult vaccines went down to a zero copayment when you got them. In 2024, the income limit for extra help, the eligibility to qualify for that extra help program was raised to $150 of the federal poverty limit. And then we also saw in 2024 that the copayment for your medications for those who reached the catastrophic stage in 2024, if you reached that, then your copayments went down to zero in 2024. In 2025, we're going to see a new model for prescription drug plans. We're going to see that there are only 3 stages of coverage instead of 4. We're also going to see that the out-of-pocket maximum, remember that's that safety net that I explained earlier, is going to significantly be reduced from $8,000 to $2,000 in 2025. So that's really great news. And then also we're going to see a new payment plan for some people who feel that they might need it for their prescriptions. In 2026, we hope to see that Medicare will be negotiating directly with the drug companies to lower the price of some of the medications. So let's take a look at the Part D or prescription drug plan model today. So every prescription drug plan must have this foundation. It must be at least as good as this or better. So you might see that different insurance companies may offer different variations of this, but it has to be as good as this or better. It cannot be, they have limits to what they can charge. The other thing that you're going to find is while this model is very, is for every carrier What you will find is that the list of covered drugs will vary from one plan to another. The other thing that you're going to find is that your co-payments that you'll pay will vary from one plan to another. But if you look at the bare bones of the plan, they're all built this way. So in stage one, which comes in January, this all goes by a calendar year. In January, we all start off at stage one, where there's an annual deductible for your medications. And if your plan has a deductible, then you are required to pay that deductible before the insurance company will cover any of your medications. Now, as I mentioned, some insurance companies may not have a deductible at all, and some other insurance companies may offer a deductible only for higher cost medications. If your plan has a deductible, once you reach that deductible, then you go into stage two, which is the initial coverage stage. When you get to this stage, then what you'll find is when you go to the pharmacy to pick up your medications, you'll just pay a copayment for that medication. Now, once your total drug costs reach $5,030, then you enter what is called the coverage gap, which is when you'll pay 25% of the cost of your medications at the pharmacy. So some of you who have gone to the pharmacy and maybe were paying a certain set amount at the beginning of the year, and then maybe you noticed that your copayments were changing later on, it's very possible that that happened because you reached the coverage gap. Once your true out-of-pocket costs reach $8,000, then you come out of the coverage gap and the insurance picks back up again, and you pay no copayment for the rest of the calendar year again, and then you start all over again at stage one in January. So this is what prescription drug looks like, plans look like today. Let's take a look at what it's going to look like for 2025. In 2025, as I mentioned earlier, instead of having the 4 stages of coverage, we're only going to go down to 3. And then the out-of-pocket maximum is going to be significantly lower, which is great. At the beginning of the year, in January, we will all start at stage 1, where there is an annual deductible. Now, the deductible can be as high as $590, but pay attention to your plan documents because it's very possible that the deductible on your plan could be less, or it could be just a deductible for certain medications and not all of them. So your plan will send you something called the annual notice of change that will come in at, sometime between September and October. And when you receive that annual notice of change, it will tell you on that document if you have a deductible, how much that deductible is, and for what medications. So if your plan does have an annual deductible, once you reach that deductible, you will go into stage 2, where you'll just pay a copayment for the cost of your medications at the pharmacy. And then once your out-of-pocket costs reach $2,000, you immediately go into stage 3, which is the coverage, the catastrophic coverage stage, where you will pay 0 for the cost of your covered drugs for the rest of the calendar year. And then again, we'll start all over in January of 2026. So again, pay attention to the annual notice of change that is sent by your insurance company every year. I think this year is especially important because there are several changes that are coming for the prescription drug plan. And because of the changes that are coming for the prescription portion of your coverage, it may affect other areas of your plan as well. Now, I mentioned earlier that there is a $2,000 out-of-pocket maximum, and this amount can be very daunting for people who are on a fixed income. And for that reason, Medicare is requiring that all insurance companies offer a prescription payment plan. So if you think that you will reach the $2,000 in one calendar year and you need help spreading that cost out over 12 months, then you can reach out to your insurance company. They haven't announced how they're going to put this in effect, but they are required to offer it in 2025. So be on the lookout for information from Medicare as well as from your insurance company explaining to you what steps you need to take in order to enroll in this payment plan. Okay, so it won't be automatic. You must take action in order to enroll in it. And what it will do is it'll spread that $2,000 out-of-pocket maximum over 12 months instead of you having to pay those, between fewer months at the beginning of the year. So for those of you who are on some pretty expensive medications, I think you're going to find that this is going to significantly reduce the cost of your medications in 1 year. And then for those of you who are on generic medications or who may not take a lot of medications, just know that what you pay at the pharmacy come January 1st may be different than what you're accustomed to. And if you see that your co-payments are different, maybe a little bit higher, it might be because you have that deductible that you have to meet before the insurance kicks in. I'll also go over this program that is called Extra Help. Now, Extra Help is a program that's available to people and it's based off of your income. So if you meet certain income requirements, then you can go online and you can apply for this Extra Help program that will reduce or eliminate the cost of your prescription drug coverage. So your premiums could get reduced or eliminated, and then your co-payments for your medications could also be reduced or eliminated. And then the other great thing, if you qualify for this Extra Help, is that you will not have a deductible that you have to meet for your medications. So some help there for people who might need it. If you need some assistance in applying for this Extra Help program, or if you're not sure if you qualify, I'm going to put my information up at the end of this presentation. Feel free to reach out to me and I'd be happy to run those numbers. So in Texas, if you are single and your income is $1,903 per month, that is gross monthly income, then you may qualify for this Extra Help program. For a married couple, the income limit is $2,575 for both people. And again, this is gross monthly income. There are also some rules about how many assets you can have and the amount of money that you can have in your savings account and so forth. So if you meet this income criteria and you want to know more about this program, please don't hesitate to reach out because it really can help some people lower the cost of their medications. So I mentioned earlier that I was going to put my information out there for you to reach out, but you can also help as well. There are a lot of changes that are coming for 2025, and what I would really like to avoid is having a client who shows up at the pharmacy to pick up their medications and they're surprised at the change in their copayment from 1 year to the next. So I ask you guys to please help out by spreading awareness, making sure that you're talking about it with your friends and your family, your church group, your bunco club, your reading your book club. So just spread the word. That would be very helpful. Encourage your friends and your family to review the annual notice of change. This is that document that I told you that comes every year between September and October, and it explains exactly what is changing for your plan for the coming year. And then feel free to have your friends and family reach out to us for information. Our needs can change from 1 year to the next. Insurance plans, Medicare plans can change from 1 year to the next. And so it's always a good idea to sit down with a licensed agent who knows the plans in your area, who knows the network of doctors in your area, and who can help you determine if the plan that you currently have is still a good plan for you for the coming year, or if maybe it's time to make some changes. At our agency, we only make changes for people if we feel that the client has something to gain. So we will be the first to tell you if you come into our office and the plan that you have is the best fit for you, we will be the first ones to tell you to stay where you're at. I hope you found this video helpful. Thank you so much for taking the time out to educate yourself on the Inflation Reduction Act and some of the changes that we can expect to see in 2025. My name is Margarita Cordova. My cell phone number is 210-373-4840. Feel free to give me a call or send me a text if you need some more information or clarification on anything that we covered today. I really appreciate your time. Be well. Thank you so much.